This is Thomas Buell. I'm a neurosurgery resident at the University of Virginia. This video demonstrates prone positioning on a standard operating table for lumbar decompression or discectomy. Instead of using the Wilson or Wilson Plus frame, we demonstrate appropriate prone positioning using chest rolls in this non-overweight, non-obese patient. Here's a standard operating table, foam pillow to cushion the face, chest pads to support the chest and hips while letting the breasts, abdomen, and genitalia hang freely, and pillows to pad the lower extremities. Adjustable arm boards are modular and can be attached to the standard operating room table in preparation for Superman prone position, since the operating area is below the level of T6. The team works together to safely roll the patient. Initially, the longitudinal support pads are too wide. The abdomen may be compressed by the operating table, leading to vertebral venous engorgement. Also, chest wall restriction may lead to altered respiratory dynamics. In longer prone cases, especially in obese patients, this may lead to higher airway pressures for appropriate ventilation. This can increase intrathoracic pressure, decrease cardiac venous return, and preferentially shunt blood to the vertebral venous plexus and veins. Here is appropriate width of the longitudinal chest and hip pads, letting the breast, abdomen, and genitalia hang freely. The Foley catheter hangs to the side of the table. This is the final prone positioning for lumbar decompression or discectomy using a standard operating table and chest rolls. Note the well-cushioned face to avoid pressure ulcers, neutral cervical alignment, appropriately flexed and padded upper extremities to avoid over-rotation, hyperextension, or peripheral nerve injuries, padded knees and tibial support with lower extremity flexion, which may reduce the amount of retraction on the affected nerve root necessary to perform discectomy, reduce lumbar lordosis, which can facilitate bony decompression, and reverse Trendelenburg position with eyes above the level of the heart to reduce ocular pressure. The operating team works together to safely rotate the patient back onto the hospital bed. Face is inspected and there are no pressure ulcers. This concludes the video.